Shot we're waiting on that because I'm not. I'm fabulous. My name is Beth. I'm going to be the nurse doing your physical assessment today. If I do anything that hurts, let me know and I'll stop. I have interviewed. Are you guys recording? Okay. I have interviewed the gentleman subjectively, so I know he's alert and oriented ×3. I'm going to do just a quick general skin assessment. I'm going to look at his arms and his hands. His skin is light brown, creamy, warm, dry, with normal hair disbursement. His cap refill is less than 2 seconds. Nails are well adhered to the nail bed. Can you do this for me? Beautiful, no evidence of clubbing. I'm going to go on to the hair and the scalp, and he's got a thick head of dark brown hair, evenly dispersed, no evidence of alopecia, and no evidence of any infestations. The scalp is pink and mobile, and we're good to go. And then the skin of the face is symmetric, equal hair distribution. He's got a couple of small, well, we know that they're small, one dark brown macule above his left eyebrow and a couple of light brown macules. And otherwise, we're good to go with regards to his skin. I'm going to go ahead and have you flip your legs around this way. Don't fall off the table. Because I'm getting short of breath. It's the pregnancy. Yeah. Okay. And I'm just going to open up the posterior gown. Hair disbursement. He's got a skin art, decorative skin art at the top, and that's as much as you really need to say about any tattoos. I don't expect for you to describe them.
But you wouldn't like a scar.
I wouldn't call it a scar. I won't even call it a tattoo. I'm just going to call it skin art, and I'm going to leave it alone. He's got a couple of macules dispersed. None of them look suspicious at all. So I'm not concerned with those. I'm just looking at his breathing. His musculature is symmetric. The anatomy appears symmetric. So I've inspected. Now I'm going to palpate. I'm just going to touch your back. Let me know if anything I do hurts. Okay. I'm just feeling for any masses. Don't feel any masses. The spine is well aligned. Okay, so I've inspected, I've palpated, okay? I'm going to go ahead and percuss. So I'm going to start at the apices, and I'm just going to percuss. I'm not going to percuss over the scapula.
Mary, is this when you can have him hug himself?
You can. Just go ahead and give yourself a hug. And it will spread, it might spread so you get a little bit of a better listen. But if you can feel where his intercostal spaces are, you don't need to have him do that. It's easy for you to do it, and you'll know when you, relax. And you'll know when you do your physical exam with your partner what's easiest for you to elicit a good sound, okay? So percussion produces resonance throughout, and that's an expected finding. I'm going to do 3 quick little tests, and I'm going to group them all together. I'm going to go ahead and have you take a deep breath. Okay, and one more. Beautiful. So diaphragmatic excursion is symmetric bilaterally, and I'm going to look at his anterior posterior to transverse ratio, and that is 1 to 2, and that's an expected finding. And I'm going to go ahead and just tap your lower back and let me know if you have any pain. That, no costovertebral angle tenderness. Okay, and that's what I would hope that we would have. I'm going to go ahead and take a listen. So I'm going to have you take a deep breath in and out through your mouth. And if you start getting lightheaded, let me know, and we can take a break. I lose points if my patient falls off the table. So I'm going to start up with the apices. Go ahead and have you take a deep breath. I can hardly hear anything through the stethoscope. You doing okay? Okay. Posteriorly, breath sounds are clear to auscultation bilaterally, and that's what I would expect to hear. Okay, am I missing anything for the posterior thorax? Okay, I'm going to go ahead and swing you around so you're facing the eupnic breathing. We know what eupnic breathing is. Easy breathing, non-labored. Skin, again, is kind of that creamy tan. He's got a couple of scattered macules that I'm not concerned about. Normal musculature, it appears symmetric, and hair disbursement is equal. And again, eupnic breathing. I'm going to go ahead, so I've inspected, I'm going to go ahead and palpate the anterior chest, and I just want to make sure I'm not in your way. So anything that hurts you, just let me know. Any pain? Okay. Now, I'm going to avoid the breast tissue because we're actually going to worry about that when we do our breast exams. So I'm going to get underneath and just kind of follow his rib cage. Okay, any pain, tenderness? Excellent. Okay, so no tenderness, no masses or lumps found with palpation. And do we percuss the anterior chest? No, so I'm just going to take a listen. And I'm again going to start at the apices.
Would you comment also on the angle then, or do you do that another time?
Does she have you comment on the costal angle?
No.
No, yeah.
Just nearness.
Yeah, that was just one of those extra things to cover. But you could say that his costal angle is less than 90 degrees. Okay, and that's an expected finding. Okay, I'm going to go ahead and have you take a deep breath in and out through your mouth. And I'm going to start up with the apices. Here's some vowel sounds. Now I'm going to make sure I get this right middle lobe real good. Okay, breath sounds are clear to auscultation, and that's an expected finding. Okay? And that's it with the anterior chest. Any questions? Okay. I'm going to go ahead and I'm going to lay you back. And I'm going to do your cardiac exam. Drop this.